People of St. Martin, here and abroad, I hereby address you as Prime Minister and Chair of the EOC in an update for today, Monday, May 11th, 2020, as part of the process to keep the community of St. Martin informed about the latest developments and government's response to the COVID-19 reality. I would like to take this time, one day post Mother's Day, to wish each and every mother figure, and person who makes an impact on our youth a happy belated Mother's Day. Know that I'm sure you appreciate it every day, and that I'm very happy we had the opportunity yesterday to relax and be put in the sunshine and receive our due as mothers. I wish that each and every person would remember to enjoy their mothers while you have them, because the time goes by ever so quickly. I would like to take this time to thank each and every one who has tuned in over the past weeks to our broadcast. It is, of course, our pleasure to be able to inform you, and our duty, as a matter of fact, during a disaster. And I am very happy that we are doing all we can to mitigate the spread, and it is working, you could say, more or less according to plan. We are seeing the numbers going down, and I can say that today marks 13 days since we have had a positive case. So that's 13 days without any new cases, and that is a very good sign. CPS will continue to do its outreach within neighborhoods, and I will give a little more information about that. But as per the cases that we know about, we still remain at 15 active cases, of which 4 are at the medical pavilion, and 2 are actually, according to the St. Martin Medical Center, already recovered, but still undergoing treatments for other situations regarding their health. 11 are in self-isolation at home, and I ask that they continue to isolate properly until they have been given the green light by CPS. To the general public, I must say that I have noticed that even though today was the first day of the openings for this week, that I did not see a manic rush. And so therefore, the behavior of our population is now completely in line with our new normal. And we are getting accustomed to the way things have been. And we will continue to put our health first and stay at home as much as possible, only going out if we are essential services or as is needed for work, or to purchase essential needs. This morning, I would like to update that in our weekly meeting held with the French counterparts, I sat together with Madame Préfet Sylvie Faucheur, President Gibbs, First Vice President Valérie Damaso, as well as the Minister of Justice, Anna Richardson, and of Health, Richard Panafleck. Together with our support staff, we had a discussion pertaining to our updates on the COVID-19 realities, including the health situation, border controls, and the de-escalation measures which we are both carrying out. As a result of our meeting today and not having enough time to go in depth, we have organized a second meeting for this week specifically to go into the discussions on our border controls. This is a situation whereby, and also the reopening of schools, as we have children on both sides of the island needing or probably wanting to go to school. Collective Prevention Services, CPS, has been executing the community outreach program for the past 3 weeks. In these 3 weeks, they have visited a total of 14 neighborhoods, and in these neighborhoods, some 1,915 homes consisting of a total of 5,132 persons were visited. 36 of them reported to have flu-like symptoms, of which 21, after being contacted, agreed that they did have symptoms and to be tested. One person, I'm sorry, not all 21 tested. 10 did not have flu-like symptoms, and the others had some chronic illnesses, which they were referred to their doctors. 5 persons refused to be tested and did agree, however, to remain in proper isolation. This past weekend, CPS expanded to the districts of Belvedere, Bishop Hill, and Middle Region, and will continue to visit not 5, but 6 more neighborhoods. It is a good note that we, from the beginning of the community outreach, have had only one person that has confirmed positive. And as we continue to outreach, we will inform the general public if more cases are found. That case was several weeks ago, however, in the early part of our outreach. And for the past 13 days, as I said earlier, we have had no new cases. As such, we have moved forward. And as you know, a multidisciplinary task force was established whereby criteria was looked at based on the health aspect, based on the social need and demand, as well as economic need and demand. And a rating was given whereby we came up with 4 phases. We had expected to move directly into phase 2, but seeing that several new businesses came online that qualified to be open in phase 1, we felt that it was imperative to give them at least a week to get things up and running. Of course, when we state that in a particular phase, a business is allowed to be opened, that does not mean that it is mandatory for them to be open. Businesses that are allowed to be open during this week, May 11th, which you can see on our screen, may only do so once all the guidelines are in place and the business or entity agrees to open to serve the public. As such, entities or businesses can decide to defer their opening to a later date as well. So, any persons requiring a particular service or are questioning whether a service that they need is open should check to ensure before leaving their homes. The guidelines have been printed and shared, and stakeholders continue to meet to finalize preparations and plans to be able to open as per the dates listed. Again, I must mention that many have decided, and especially as it pertains to the daycare centers, to defer their opening until they can properly put all guidelines in place. I can update from the Ministry of Education, Culture, Youth and Sports that they are having meetings together with the school boards to determine when and how the schools would reopen if they were to reopen. And they are mainly focused, as of next week when they're supposed to, on the exam students. As several exams have come back online, they would like that all students get the opportunity to do so. They will follow up with meetings on Tuesday with the relative stakeholders. Also, the Department of Youth is busy discussions with the SECDA, SECDA, which regulates daycare centers, in order to ensure that the guidelines are completely understood before they open. Persons who require the services of whether it is daycares or schools should look out for when these schools make announcements as to their opening and under what conditions. Some of the guidelines are, especially where school is concerned, that there will be an amount of students that is congruent with our social distancing rules. And again, many schools will opt not to open. Another thing that we should keep in mind is that as parents, it is totally up to us to decide when our children will return to school as well. What is a concern for government and the ministry is the students who have been probably not able to follow classes besides the exam students. So those are the 2 priority groups that they're looking at, and you will be updated further either by myself or the Minister of Education as we move forward in this regard. General guidelines for businesses that must be upheld at all times is the wearing of masks. This is mandatory. A distance of 2 meters or 6 feet between all persons, including employees and customers. So some businesses have opted to have only partial return of their employees and maintain that, especially those employees that can properly work from home, remain at home and do so. Government is also assessing, our own situation to determine which members would be needed to come in. As such, the frontline office also will be putting out a schedule as to when and how the public will be able to visit government offices. Other guidelines necessary is the implementation of sanitation stations in the entrance and throughout the business in strategic locations. Frequent sanitization of common touch areas and equipment. Wearing of a protective shield in the event the 2-meter distance for service rendering is not possible. So that is particularly by dentists and other businesses where you have to be close up to persons. So in those cases, not only are you required to wear a mask, but also a protective plastic shield. In businesses where there are aisles, one-way aisles must be indicated, and proper social distancing also must be possible within these aisles. Limiting persons in the establishment to ensure social distancing at all times is a must, and the markings or barricades on the floor to ensure that proper social distancing can be observed. If workers are very close to each other, of course, and also are too close to customers, plexiglass or glass must be there to protect workers and shoppers. Clear and visible signage, of course, regarding the COVID-19 directive is also expected to be displayed at all times. We have also been approached by public transportation as to how come they are not able to start this week. I must reiterate that we had expected to be able to implement phase 2 this week, and therefore lost sight of the fact that with adding the other businesses in phase 1, that bus drivers did not get the opportunity. As such, we had hoped that they would have also more time to plan and prepare to ensure that they can follow the guidelines for public transportation. And in the next 2 days, their buses will be inspected. And if all goes well, then on Wednesday, they will be given the opportunity to also operate. Again, all buses must be properly marked as to where they're going and follow all the directives of the Ministry of TIAT and its inspection. And more information regarding this will come forth from the Ministry of TIAT and specifically from Public Transportation and the Inspectorate. In closing, I would really like to thank the people of St. Martin, because due to your great behavior over the past few weeks while we have been locked down, as they like to say, or safe at home, as I like to say, you have had a lot of practice in keeping yourself safe. Those on the front line, not so much. However, as we move into our new reality and more persons get the opportunity to be out and about, I ask that you remember to be conscientious of the persons around you. Going out in public, of course, having more people moving can always lead to a resurgence if there are persons who are out there with COVID-19 and have not come forward. So don't be afraid. CPS will look out for you. Your general practitioner, your family doctor will assist you. If you are having any type of flu-like symptoms, I ask you, please get in contact with your doctor or CPS so that you can be properly monitored and that others around you can be safe. Contact tracing for all those positive patients has continued and will continue as any new cases may pop up. We hope and pray, of course, that that isn't the case, but better to be prepared than to be sorry. The experience with COVID-19 will forever change or alter the way we interact, as well as our hygiene practices. I know for sure it has taught me to be more conscientious of everything that I'm touching and of what all you may be tracking back into your homes. In the short term, we know that social distancing, wearing a mask, Practicing good hygiene will be the norm for St. Martin and the rest of the world for some time. So far, we have not seen the widespreading of the COVID-19 virus on the island. It has been properly contained up till now, and that means our measures are working. And it also means conforming to our new norm. For our continued safety, for the safety of you and your family and all those persons whom you love, these measures must be a part of your everyday life. Remember, our resilience is not just a word, it is who we are. We always fight back. We always come together, and we always help the weakest among us. So I'm asking you to stay blessed, St. Martin. Never lose hope. We are moving forward, and we will conquer this new adversity as no one has ever had to in the past, and as we will show them in the Caribbean how St. Martin recovers, just like always, faster than expected because of you, the people of St. Martin. Stay blessed.